Okay, we're back from that break, and before that, Ray was on the phone and discussing susceptibility to colds and flus and how that changes in the weather. And we do see summertime colds. We do see those outbreaks, but people are outside more, and there's less risk of probably, I think, time exposure. Some people will say, well, you see a lot of sick people, why don't you get sick that much? And we're not really in contact with that person all that much. And remember what I said about washing your hands. It's very important to wash the palms of your hands and try not to rub your face, because you'll put those virus particles close to your face, and you will have an increased risk of exposure. But it's usually hand contact, and then that, unless it's aerosolized through a sneeze, and then you'll get an adenovirus, which is can cause an upper respiratory type of infection. And there's different types of upper respiratory infections other than just influenza type A, B, or a variant thereof, or the rhinovirus, which is a cold. And certainly if you're a diabetic, that does reduce your immunity. As I've said before, diabetics, they imagine that your tissues normally we have this, what I call is, if you had a stainless steel hinge on your door and you sprayed distilled water with no solutes on it, then the water will evaporate and the hinge will not rust, and there would not be any problem. However, if you put a little bit of sugar in that water on that stainless steel hinge, you will not get rust, but you will get a gummy appearance to the hinge, and therefore the hinge will not work very well. And that's what happens in diabetics. Their white blood cells and their other tissues become gummy and a little bit sticky, so therefore they have an increased risk for infection based on the slower moving of their white blood cells, because they have to actually come in there and kill off the virus or kill off the exposure. And it is important to think about your immune system as this very dynamic process that you have to have in order to fight off infection, meaning there's no antibiotic, and the influenza vaccine, while effective for a short period of time, is not really effective over a long period of time. So you have to have an intact immune system to be able to rid yourself of these particular viruses and colds. And one of the things that, if you feel like you're getting a runny nose in this time of the year, or you feel like you might be getting a scratchy or a sore throat, I like to use Sambucol as black elderberry. It's an immune stimulator. I also like zinc and heavy metals. They interfere with viral attachment and replication. Colloidal silver is one of those things that is very effective. However, obviously you've seen or may have heard of too much colloidal silver can be bad for you, and that's certainly true. Echinacea is an over-the-counter product that can be very helpful in preventing colds and flus. So lots of vitamin C can be very helpful, vitamin D. So if I had to give you a regimen rather than give you an antibiotic, it would be, if you feel like you're getting a scratchy or a sore throat, or your body is aching, you might want to get that Sambucol going, get the Echinacea, get a little bit of the vitamin C, vitamin D, and try and rest a little bit. Give yourself a chance to knock this out. And I've been very impressed with that regimen as far as being able to subdue colds and flus to a bare minimum of existence. I know when I did that last year, I felt like I had something coming on, and it pretty much knocked it out in 2.5 days, 3 days, instead of it's running a week-long course. Sambucol you can buy over the counter. You can get it on Amazon. I like the liquid form of it, and they sell all the other stuff, so in the health food stores and things of that nature. So that's my homeopathic remedy, which I think is very effective. Antibiotics, again, really, a lot of people will come into the office in the early stages of a cold and flu, and it's good if you have COPD or you do have a chronic lung condition. I do want to probably put you on a low-dose antibiotic for 3 or 4 days to prevent you from developing a more serious complication of a pneumonia. And pneumonia is one of those things that comes out of a a lung that doesn't aerate very well, meaning air and oxygen is a very potent oxygen is an oxidizer, so it'll destroy bacteria. So if your lungs are not very aerated very well, then guess what? You set yourself up for, if you had like COPD and a mucus plug, you couldn't open your lungs very well, then you would develop possibly a pneumonia after that. Ray, you're back on the phone.
I'm back on the phone. A couple things. First of all, I want to point out that I wear gloves all year long, and people think I'm a little whacked out. Of course, they think I'm whacked out for other reasons, but the gloves, because I know I'm going to be shaking hands with a lot of people, and I'm just leery about getting a cold or something else. And I think it protects everybody, me and the person I'm shaking hands with, because if you shake 20, 30 hands a day, you know, I'd be passing it on to people. The second thing I want to point out, something I see in court on a regular basis, Doc, that really bothers me, and that's these forced blood draws. They'll get somebody for drunk driving, and they'll force them to take blood. They'll strap them down in what they call like a chair and force them. And some of these people are really upset, and they're yelling and screaming, don't do it. They'll hold them down and they'll take the blood. There's a new ruling by the Supreme Court called McNeely, which says they cannot just do that arbitrarily. They need a warrant to do it. But even so, the body should not be violated because they think that you've been driving drunk or whatever. They got different ways of testing that. They've got tests on the street. They can do it. They got the breath test, but they want to make sure they can prove it in court. And I think it's completely outrageous to force people to give blood because they're suspected of drunk driving. And when I see it on video where someone is fighting and 4 people are holding him down and are putting a needle in his arm, it really upsets me. And I wanted to point that out on your show because I think you'll agree they should not be doing that.
Yeah, I would agree with that. I think that giving up your blood or your bodily fluids for an investigative purposes, I think that's an extreme invasion of privacy, and I mean, if that's the way it is, the courts have just gone way too far as I'm concerned. I always thought that if you refused to give a blood alcohol test, that they just yanked your license at that point, and that was just part of that. But maybe that has fallen out because they couldn't prove it. I don't know. That doesn't make sense, and I'm hoping that, I mean, you say that's true. I think that if the viewers, if you're aware of that, and Ray, obviously you keep up with those things, that's horrible. In fact, along that line, I had a conversation with one of the pharmacists at Walgreens. I was calling in a prescription that Walmart wouldn't fill, and the patient had to transfer their prescription to Walgreens, and this one pharmacist was telling me they've come out with a new, it's in, I don't know, clinical stage 3 trials where you actually wear something that's on your stomach that's a Band-Aid, and the pill has a microchip or something that's dissolved in the acid so that they can actually tell that you've taken these prescriptions. And I thought, oh my goodness, if this is where we're going, this is horrible. If this is a compliance issue, we're not going to pay for that antibiotic because you didn't take it. If they're trying to see if you're actually taking the opioids that you're being prescribed, things of that nature, that's a horrible direction that we're traveling.
It's going completely overboard.
Yeah.
But I see in court I hope more and more people will stop in and just observe. You don't have to do anything but just watch. And you see what I'm saying is the truth. And I've been doing this for 13 years on a daily basis. And it's really upsetting to me to see that they tell you once you get your driver's license that you've already said, okay, you can draw my blood. That's not how it is. You got a license and they just add all these different requirements on. That's totally ridiculous. It should be done away with.
Yeah, no, I agree. I mean, driving is a privilege, and it's not your right to do it however you want to. And with that privilege, it can be taken away if you are doing the wrong thing. I mean, I had one patient who came into my office who was arrested. He was actually he was pulled over. He actually took a medication. He was actually driving, and they pulled him over. They did his blood. He thought he had taken a pain pill, and he actually took another type of medication, which caused him to drive recklessly. His blood alcohol level of Xanax, which was the other medication, was extremely high. But unbeknownst to me, there is no legal limit or intoxicated limit for Xanax. So they couldn't get him for DUI, driving under the influence, because there is no illegal limit for that particular product. And I thought that was very, very interesting. They did hit him with reckless driving, but that's all they could pin him on. And I would think the same thing would be true for alcohol. If you have a BAC, they don't detect it. If you have a breathing test that's positive, it's reckless driving, and I don't know what else they need. I can't believe they're holding down people to do that. That's.
And the last thing I want to point out, and I see this in court, and that really upsets me, is where they force people to pee in the cup to see if they're dirty as they're being prosecuted. That's a Fifth Amendment violation. I tell the judges when they're outside the courtroom, I said, you shouldn't be doing this, because they're incriminating themselves. If they come up dirty for oxys or whatever, they can get 25 days contempt of court. It prejudices the judge against that person because they say they came to my court under the influence. It's just they got to stop it. It's just out of line. Hey, I'm glad you're there today, and I'm enjoying the show, but I don't want to tie the line up for the full hour. So you have a good night, and thanks again.
Okay, no, thank you. Those are very good comments, and maybe after the break, which we're going to take one in another minute or two, we will talk a little bit about the urine testing, because that is another interesting thing. I think they, if I'm correct, they basically give up the right to, they go prosecution to go to jail if they agree to in drug court to give those urine screens. So I think there's a trade-off in that respect. So anyway, we're going to come back from break, and hopefully we'll have some other callers and some good topics to talk about. Thank you.